noticing they leave money for him. Evidently he liked to play with change.
Okay.
Candy. Oh yeah.
Setting this thing down on the window sill.
Can you roll that back?
Warmer from the top.
Low.
What?
Low. How are you, Jacob? I want you to know none of us are here to hurt you. We just want to come and spend some time with you and talk. Nothing's going to happen, I promise, okay? Is there anything that you'd like to talk to us about? Well, let us know.
Those have to be. Those words have to be what somebody else wrote on there, right?
Yeah. Yeah. I'm not sure his age. Jacob, how old are you, buddy? Sure do have a lot of nice toys on the floor. I just pushed your truck across the floor a second ago. Is there any way you can make it move? Like I said, nobody's here to do you any harm. We want to hear your side of the story. A lot of things have been told to us, but we just want to see what you think.
Surprisingly, that is not within my capabilities.
us some kind of sign that you're here with us.
Can you tell us which one of these toys is your favorite?
You have to have any type of activity in here before, or?
They have, my wife, when we were here last year, like I said, we couldn't come in. She took a picture and it was kinda like a mist over here. But I mean, there was a significant change in temperatures inside and outside, so I can't say 100% that's what it was, you know.
Nothing like no EVPs or nothing?
For a long time, they had it closed off, so I'm not sure. I think he was after the boys' school, the only child that, you know, other than Dr. King's kids that lived here. His mom was a patient here. So we've been told, you know.
But he actually died here.
Yeah.
Did they say how it happened?
Supposedly he was a male that lived in the room over here that killed him. I think some other things went on and it killed him. Is that correct, Jacob? I know it's hard to talk about.
Can you tell us the name of the person that hurt you?
Can you tell us what he looks like? Can you tell us when it happened? Like the date? your mother's name?
So where did they paint this here?
I have no idea. I don't even know how long it's been there. If they did it or if it was there before.
Sure, it just makes a good haunted house, pop.
Because it's pretty much not child size.
No, that's right.
Unless it's like Baby Huey, you know, but
Yeah. Yep. In that, what was it, last night in the kids' room, Candy noticed that all of the handprints on the child's room, wrong size.
oh really?
Yeah.
A lot of them were, yeah, as big
Yeah,
front hands.
yes.
There was a few that were obviously children, but the majority of them were adults, infants. And the paint that they were done in was obviously not,
It's pretty new.
yeah, it's sparkly
It's
new.
not blood.
Right.
Yeah, not blood, it's not,
It's not pig's blood either.
it's not the old style paint either from even when I was a kid. It was
Right.
New acrylic.
the new acrylic, yeah, sparkly, metallic stuff.
Yeah.
I think we went in there last night.
It's near the Alcoholics,
Yeah.
if that actually wasn't.
Right. It'd be kind of weird to have a daycare, right?
Yeah, it's,
Right at the
doesn't make any sense.
Mm-hmm.
You have the,
cheap babysitters.
you have the lounge next to the paddock room. You know what I mean?
Yeah.
People were having fun and then there's people sitting, you know, isolated for the,
Didn't make any sense.
Yeah. I feel like the whole layout of the building itself is just, it's awful.
Well, as firefighters, don't you guys have maps and stuff or access to some of that stuff that when you go into, say, a modern hospital, those are buildings that you can't just, you know, if you're clearing one.
those are all pre-planned, like, they go through a whole big process before they even sketch it out and build and stuff.
Right, but even, I mean, even back years, this was obviously still in operation in the
Yeah.
80s.
Like anything built before 1974 is like exempt.
Right, but still at 1974, this was still a hospital in 1974.
Yeah,
So
I know that we do a pre-plan. Like for us, like my station's every Wednesday. We pick different places in their area, go pre-plan them all, you know.
But that's not something that would be on record or accessible for something in the
No.
mid-80s.
Now, the thing that I used for the plans that I drew out, it's a blueprint that's online for St. Albans. And if you know, like a lot of the laws are different. It'd be kind of hard. Well, I mean, I guess we could do some record searches,
Right.
you know, here and see what we can find. But as far as like online and stuff, it's really nothing that. The only correlation, I have a friend whose dad was here. He was only here for a few weeks before they opened the new facility.
Right.
So I mean, he might be able to. That's that's something I don't know, I feel weird asking somebody.
Right.
But you also gotta look at the layout, it was basically designed off of a boys' school
Mhm.
originally.
Mhm.
So everything else was added.
Right, 'cause we had the two buildings, and then they added the middle section
Right.
to put them together.
But it was definitely a medical facility, I mean,
Oh, yeah.
for what they had.
Yeah, he remembers coming here and seeing his dad. So,
Well, the guy who owns this, right, he was a patient here at one time, right?
I don't know. I've only dealt with Marcel.
I thought the people here were buying this. He was actually a patient one time,
Huh.
and that's one of the reasons why they wanted to keep it and restore it.
The whole time.
How much would a place like this cost? If they were selling it.
It's online. I found it. I can't remember what it is. Yeah, I actually found the auction listing for it.
Any clue how much?
Just curious.
Actually, it went cheap for what it was, for the size of the
It's
building.
pretty tore up, so it couldn't much been
It's
3/4 million.
55,000 square feet. So, yeah. Where I found, I don't know, because they had the whole plot, and then they had it sectioned off into different ones. I think this one cut most of this, but I'm thinking part of that center was on
Mm.
the one beside it.
Yeah, kind of raised the price a little bit.
Yeah. But I think Bradford owns that. Probably. And that we can find out that pretty easy.
If you renovated this, what would it be?
I can tell you what it would end up being, probably government housing. That's what everything goes to
Right.
around here.
Right. That's exactly what I was thinking. It'll turn into a giant slum.
I think the intention is to fully restore it and make it a museum.
It's an expensive museum.
And talking about having weddings and stuff like that, I think too.
Yeah.
Yeah. Which they've had a couple weddings here the way it is.
Really?
Yeah. So they told us.
Well, they had the zombie wedding.
Yeah.
Yeah.
Does it really count as a wedding?
No, I mean, they actually, I mean,
Yeah,
it's a real wedding. They just
They dressed as
up as
zombies. It was a zombie bride, zombie,
Okay.
that's just what they were into.
Yeah.
Wow.
They do
They had a
zombie
barbecue
games
in the
here.
backyard before I did that.
Yeah, they do like every few months they do a survival game here, a zombie survival game.
Yeah, that's what Shelley was saying.
And I guess you could see, I mean, we moving around, last night, it's hard to get out.
Mm-hmm.
So, I mean, they have staged weapons, different places. To me, it sounds kind of fun, but
Yeah.
It does, actually.
Yeah.
Yeah, this would be
Kind of like
a heck of a
paintball
lot
on
of fun.
steroids.
Yeah, for a paintball or some mount training of some sort.
oh yeah,
Oh,
Definitely.
absolutely.
It'd be a hoot. But
I mean, they could probably make a lot of money doing something like that. Just keep doing it.
and I don't know if them doing ghost, hunts and stuff is enough to
It
keep
can be.
everything
can't
going.
be.
You know?
It can be.
No way.
How often you do it?
It depends. Last year it was pretty booked. I know they do twice a month a flashlight tour, where just people come in and say they do the group hunts where, just
You're with them.
anybody comes in and you just split you up, take it. And then the private events.
The place, was a man, was killing, I don't know if you've heard of it, sold the Sorby House. It was on Ghost Adventures and Ghost Hunters, but, it's all fixed up and, brand, not brand new, but restored. They do, the nightly ghost tour through it. I did it once, it's $25 or $30, and it's 25 or 30 people. You do it 3 times a night, 5 days a week.
Wow.
And they, I think it was like $10,000 a week, I guess.
I could walk around and talk to people for that.
Oh, yeah.
And they go and turn around and like, we ask some people in there to do a private investigation. Oh no, you have to have a TV show.
Really?
And that's what it told us.
This YouTube count.
You there you go.
Yeah, we got SCAD there, and SCAD is like the art school.
Uh-huh.
And I was like, I just get SCAD students to have a camera crew, you know what I mean?
Oh, yeah.
Cause they got that's part of their school, they have a film department.
Right. That worked out good. You know?
Yeah, I was thinking about doing it actually. I mean, I won't get on TV or documentary or anything, but I guess in a place I'd have to do it.
Yeah.
That's why I was, well, we got contacted by a couple different production companies. Like, well, that kind of worked out, was getting these places. And I don't want to deal with all that crap.
No. That's, if you could do it and do a show that's real,
Yeah.
Oh, it's gonna be totally changed.
I mean, who's gonna sit, watch us on TV, sitting here bullshitting the whole time, I mean, you'd have to edit those parts out,
Yeah.
I mean,
You take a lot of recording time.
Like you say,
To get it 30
sometimes
minutes.
you pick up stuff that you don't
oh,
hear.
yeah. That's, a lot of times, that's the best time, is when you're not trying to find it. Anything y'all noticed last night that you wanna try today?
We can go right around the corner of the suicide bathroom over there.
Yeah, that's up one floor and
Up
down
on the
again.
floor, yeah.
When we had some blackout power.
Yeah. There was a lot of shadow play up there. I don't know if it was just 'cause we were just getting in there and your eyes getting adjusted or what, but it was.
That's on the very top floor?
Yep. That's the one Virginia was sitting right by the door, and it was about that tall. And it was only about that thick, but it looked like it would wrap around the door. That was probably the most interesting thing up there. Is it a mirror in there?
Still not know.
Well, buddy, hopefully you gave us something and we'll be able to play it back and listen. I thank you for your time. I'm sure somebody will be back to talk to you later, okay, bud?
You have a good day.
You want a recorder?
We're gonna do this. I honestly wonder what the cleanup bill of this would be.
Yeah, a lot of
Hazmat alone.
Close. Yeah.
When I first saw it, thought that was gonna be Paulette. When I first glanced at it, I said,
Do you,
oh crap, that's my name.
Do you believe in a keeper theory?
The Cupid?
Like the keeper?
Oh, the keeper? Like,
We've had a lot of places where you go and everything's great, and then bam, it stops and you can feel something else come into the room. And it's like, well, did you stop talking to us because you're not supposed to? And it's like, yes. And then after that, it's dead.
Right.
And it's a lot of these bigger places. I was talking to a buddy of mine, and their theory is kind of there's like something that keeps them here, kind of like a lack of better words, like a slave master or something.
Right.
You know, that dictates what they can and can't do. Or
I've heard of something like that before.
My grandmother didn't talk about that one time. I wasn't in conversation because I remember her talking about that with her grandmother or something. So,
I think it's
reasonable
plausible.
enough.
You know.
It's definitely plausible. I mean,
Oh, yeah.
because the lack of consistent evidence and the lack of, I mean, you know, it's kind of like chasing smoke. Sometimes all of a sudden everything's going great and just out of nowhere, it's
Yep.
gone. You know. And the other thing is, I mean, if you were a patient here and you had the opportunity to leave, wouldn't you?
Yeah.
I mean,
Gosh, yeah.
why? Yeah, why would the spirits stay
Well, I mean,
in
that's-
one place? What is that?
It's because they're stuck in their own memories.
Yep.
Just my theory.
Fair enough.
They're just stuck in their own memories. Those things were so sucky or so, I don't know, whatever, life changing that they spend a lot of time thinking about it.
Well, you see that in human beings. I mean, you see that in people coming back from Desert Storm that just can't get past it, or
Right,
you know,
yeah.
Korea,
Or
or
people that stay in really bad relationships
Yeah.
because
they just can't get
Well,
They
past
just
it.
can't
there's
get
the
away
other
from it.
option too. Was it really that bad?
Right.
I mean, when you come
Right.
to a place like that, you assume everything that happened was bad.
Right.
That these patients were treated horrible, or
I don't think everybody here was treated horrible. I think there was
Well,
some
exactly.
crazy shit
So
that
I mean,
went
do
on.
they come back because it's where they come from?
Well, this
That's
type of
why.
atmosphere before they were, I mean, they had what you called a keeper, because, I mean,
Right.
the nursing staff,
Exactly.
and the, you know, the other people, they were
That's
keeping
where we're
the
at.
people
As
here.
for
So why wouldn't they have a keeper?
On the other side.
Yeah.
Right. Makes sense.
I don't think there's anything on the other side that keeps them or holds them in place. I think there are some rules that aren't supposed to be broken. They're not supposed to do anything that would violate somebody's free will on this side. And if they even come close to it, then they get told to shut the hell up. Pretty sure of that.
Well, that makes sense.
Some kind of universal filter that kicks in if they were to cough up anything that will change your life and leave you clean dramatically. That's theories.
Well, that's all we've got. If we had evidence, we wouldn't be walking around running around. You know, if we had actual,
What are they up to?
non-refutable evidence, we wouldn't be all still trying to
Kick
find
the kid.
Supposedly that's the room that you have over there.
This one?
Yeah. Well, what's funny though? Well, I wasn't funny. Is this is a woman's school.
I bet it changed.
One that was living here.
I bet it changed genders multiple times.
Well, he was, for some reason, he was the only one that was living here on the floor. And did you hear what she said last time, that they would take gay guys and put them
With-
on the woman's floor?
with the women.
Right. And that was one of the plausible ideas of.
That makes sense.
They were actually meant to be women, not.
Uh-huh.
They weren't going to bother the women.
Right.
Although I might pretend to be gay.
Yeah.
Fox in the
Hello,
hen
gay.
house.
That's right. That's right. Fox in the hen house.
And that goes out on that little,
Yeah,
that
that's.
floor really slopes too. If you were walking through here at night.
Oh, yeah.
Oh, the whole place is not built square and it makes you feel dizzy.
It's not as hot here as it was. yourself in this one, right?
One of them, was it this one?
I think, because I know it was like, they said 4 confirmed suicides out of that one.
Really?
This one? No, this is the. This one.
Well, it's either one.
One of them she was in and said she really kind of had a feeling of someone was staring out the window.
Yeah, staring at the window, really bored, staring at trees.
Yeah.
I could see that. What the hell was he gonna do?
This would be this one?
Oh, here's gone. I wanted to take the mirror and do get rid of the psychomanium chamber. It's basically just a mirror candle. And that's it.
There's one downstairs.
But I want to do it in this one. So I mean,
That they sell. Yeah. Did you see it? It's, there's a display case, and if you look all the way to the left, you can, I haven't seen it, I see the sticker for it's like $45 or something.
Get an LED candle, so it won't burn up. Yeah, I don't get that try. Yeah, just to see if it.
Okay, I'm in the suicide bathroom right now.
That's where basically where the mirror is in the completely dark room, right? Yeah.
Yeah.
I had to get a couple of people on television and their stories. They went in by themselves, but they took the closet and lined the entire closet with mirrors. I went in there and sat in there for
And that's the whole,
complete darkness, and both of them, it wasn't the same people, but they both saw their own relatives in the,
but that's the whole view of where Bloody Mary
Oh yeah.
basically originates from too.
right. Well, I think,
One person saw it,
you know,
and it made that person see it.
yeah, the theory that I kind of have is that like, we're been in a cavern, in darkness. You see motion, but the longer you stay there, the more your mind, you start seeing what's in your mind's eye. Right. And what are you gonna see? If you're sitting there looking for evidence of the other side, how would you do that?
Okay, I'm gonna set the auto recorder down on this bathroom tub. There you go. You want the suicide rooms?
What do you think the time frame is?
I'd do 30 minutes. But since we're doing the one where, I put 2 people.
2 people in the same room? Good time.
Just complete darkness,
Both of them
complete
staring into
silence.
us.
Yeah, so there's no me swaying you and, vice versa. It's just you're sitting there and that's it. Put the recorder in there just to validate that
Yeah.
nobody said anything. So
Maybe
write
that
down
works
what you
for me.
saw.
Right.
And then, if anything,
That's right.
worth trying.
Yeah, I'm not
Well, hey, you never know.
Hey, there's no such thing
Said I got-
as bad idea.
I got an idea,
Bad
but I
idea.
don't know what you think.
I was gonna set this
Might come out
up in
with
this
the number
room
one
right here,
interview.
facing toward the,
Yeah.
the bathroom tub.
Yeah.
I already got my audio in there right now.
Okay. What if we did, since it's all open,
Yeah.
a person in each room, because it all carries, we can still talk and
Yeah, sounds good.
that way we can cover more of a kind of shot. Yeah, we can try it a little bit. Cool. We'll see what we can get, get going for you. There we go. Yeah, we're just there. We go. Okay. Slurry, 21 back in here.
Well, this room connects.
That's in here, right?
It's a Jack and Jill bathroom.
Okay.
some more chairs in here.
I don't know, I'm gonna sit in this little, this hole.
Any of y'all want a chair?
It's kind of a weird closet. If that's what it is.
Alright, see you in the back.
Anytime you guys want to do it, go ahead.
Alan,
Yeah.
this might have to talk loud, cause, yeah, I know it carries, but still, kind of low tones might be hard to hear on this recording.
Okay.
Yeah, what's your name? Let us know what your name is. We'd like to know who we're talking to.
Was that you I heard in the bathroom? If so, make another noise, please. Come on, I know you got to be able to do
if you're here, knock 3 times like this.
We need you to knock and touch one of us, make a noise, something to let us know that you're here. Once we know you're here, we can talk, or we can leave. Is there somebody keeping you, or something keeping you from talking to us, or showing yourself, or making a noise?
Don't be afraid. You can talk with us, you can communicate with us. Do you have something to say? If you do, say it now. Let us know what you want to pass on to somebody, and we can record it and pass it on to them if possible.